Chapter 54, Musculoskeletal Trauma. Musculoskeletal trauma can look simple on the surface until it turns into an emergency. Those key terms are your cheat codes. Once you know them, you will instantly understand what is happening with sprains, fractures, and amputation before anyone else does.
Ever open a Med-Surg chapter, see all the bolded terms and feel lost before reading the first line? Key terms are just a small part of the work, but they unlock the rest. If you learn term first, the rest becomes easier to absorb.
Chapter 54, Coordinating Care for Patients with Musculoskeletal Trauma. First term, amputation, surgical removal of a limb or part of a limb due to trauma, infection, or disease. So think amputee is like limb is removed and has an A, which is out or off or dead. Next, carpal tunnel syndrome. They call it STS, compression of the median nerve in the wrist, causing pain, numbness, and weakness. Carpal, it's wrist, and the tunnel is the narrow space where the nerve gets squeezed. Closed reduction, non-surgical realignment of broken bone, ends using manual manipulation. So close means it's no surgery. Reduction, put the bone back. I will have some pictures later and I will show you. Compartment syndrome, increased pressure in a muscle compartment that compromise circulation and function. So pressure trap inside muscle compartment. And I have a picture of that too. Dislocation, displacement. So this location is the local area, and this means it's moved a bit away. Displacement of a bone from its normal joint position. So bone pops out of place. External fixation, stabilization of bones using external frame and pins. It's fixed outside with pins. Fat emboli, it's fat globules entering the bloodstream, often from bone fracture. Fat from bone marrow travels in blood, and we don't like that. Fat embolism syndrome, serious complication from fat emboli causing respiratory distress, neurological symptoms, and petechiae. So fat embolism plus symptoms, it's equal syndrome. Fracture, it's a break in bone caused by trauma, stress, or disease. So it's broken bone, and there are a couple of type of fractures, and that we'll know more in outline. Hypovolemia, low blood volume, often from bleeding. Hypo means hypo here, hypo. Every time, every disease, disorders, you see hypo means low. Hypo. And the hyper means high. It's like a sound, but it's low, and volemia, it's volume. So low blood volume, often from bleeding. Internal fixation, surgical stabilization of bones using plates, screws, or rods inside the body. So fix bones from inside. Malunion, it's heel fracture in a misaligned position. Mal means bad, union, bone healing. Neuromance, it's a nerve tissue grows at amputation site, causing pain. So nerve tumor after amputation. It's kind of say neuro here, and mass where it's the area. Neurovascular compromise, it's damage to nerves or blood supply in injured area. Neuro, we know it's neurovascular. It's vascular means it's a blood flow. We have non-union. Here was malunion. Here it's non-union. Failure of a fractured bone to heal. So no union, it's no healing. Because here was healing. Here it's non-healing. Open reduction. It's a surgical exposure and realignment of broken bones. So it's an open surgery to fix the bone. And I need to scroll a little bit down. And phantom limb pain. Pain perceived in a limb that has been amputated. And feels pain in missing limb because the nerve, it's cut, and somewhere the nerve, when it's cut, like midway, halfway, part of it doesn't continue to the end, and then you feel like it's to the end, and then you feel like you have from the amputate, from the cut, through the rest of it, through the end of the toe, if it's a leg or an arm, kind of feels that it's something, a pain, like a really big pressure. And it's a constant, same like on the engine or a noise, it's constantly like zzz, and you have this pain like constantly, same like a headache when kind of boom to you. That kind of is a phantom limb pain. Sprain, injury to a ligament caused by overstretching or tearing. So it's a ligament injury here. Sprain, and then strain, injury to a muscle or tendon from overstretching or tearing. So this is a muscle or tendon injury. Strain. Just think about, has a T here, it's tendon. And then the other one, it's ligament. This is kind of to see how you distinguish between sprain and strain. Strain has a T and you think tendon. Traction, it's a use of pulling force to align bones or relieve pressure. So it's pull to align bones. I think I have a picture of it. Traumatic amputation, sudden loss of limb due to severe injury. So that is an amputation from trauma. Traumatic rhabdomyolysis, it's a muscle breakdown from crush injury causing myoglobin release into blood. And this is really a serious, it's very serious. And so then muscle melts and the kidney is at risk. Venous thromboemboli, so blood clots in venous system, including DVT and PE. So it's a clot in the vein because it says venous. Like, share, subscribe. Any comment, drop it down below. Thank you for watching, but I'm going to show you a quick few pictures of from this chapter. Since we finished the key terms of chapter 54, here are the pictures that I said that I'm going to show you. Open reduction and internal fixation. If you see like how it got together and the pins, and then the sprain and the strain and compartment syndrome. You see the leg, and here it's the rhabdomyolysis. We had that key term, traumatic rhabdomyolysis, where the muscle break down from crush injury causing myoglobin release into the blood. And here you can see it's a significant medical disorder that happens when muscle fibers break down and leak their contents into the bloodstream. And then the kidney will be at risk. I hope you enjoyed this little video, and I will see you in the next one. Thank you for watching.